Hello everyone, welcome back to the channel. Today we are diving into a crucial and complex topic in the world of medicine, leukemia. This is a fascinating area that requires a deep understanding of hematology and oncology. So get ready to learn. What is leukemia? Leukemia represents a diverse group of hematologic malignancies characterized by the dysfunctional proliferation of developing leukocytes. These disorders interrupt normal blood cell production and function, leading to a spectrum of clinical manifestations ranging from incidental laboratory findings to life-threatening complications. Guys, go back to our previous class. Yes, tell me about leukocytosis. We already discussed these topics. It's an increase in the number of white blood cells. Leukocytosis is not always a sign of malignancy. As a medical laboratory scientist, we should diagnose the reasons behind each leukocytosis. How? By blood film examination. It is better to follow ICSH guidelines. These guidelines aim to standardize practices across different laboratories and to ensure consistent and reliable results. Always remember, leukocytosis is not always a sign of malignancy. We have to find out the reason behind it. There are physiological responses, malignant processes, infections, medication effects. So, in physiological responses, as we discussed, it includes stress, pregnancy, exercise, and smoking. These transient elevations typically resolve without any intervention. Malignant process, hematologic malignancies, especially leukemias, cause pathological increase in white blood cells through uncontrolled proliferation. Infections, as we all are aware, acute and chronic infections trigger leukocyte mobilization as part of the immune response. Different pathogens may elicit specific WBC subset increases. Then some medications affects the leukocytosis. Certain drugs like glucocorticoids can induce leukocytosis as a side effect through mobilization from marginated pools. What are the specific patterns of leukocytosis? There is neutrophilia, lymphocytosis, eosinophilia, and monocytosis. What is neutrophilia? Increase in number of neutrophils is called as neutrophilia. It may cause because of acute bacterial infections, tissue necrosis, burns, acute hemorrhage, and with glucocorticoid therapy. Common physiological causes include exercise, stress, and pregnancy. Lymphocytosis predominant in viral infections, chronic infections, autoimmune diseases, and commonly in infants and children. Characteristics of chronic lymphocytic leukemia. Eosinophils elevated in allergic conditions like asthma, eczema, urticaria, then parasitic infections, especially helminths, and as a reaction to certain medications like aspirin. Monocytosis is seen in malaria, rheumatoid arthritis, and various leukemias. Monocytes play a key role in chronic inflammation and tissue repair processes. Most of the viral infections, we can see monocyte, increased monocytes. Same like after chemotherapy, we can see monocytosis. Understanding these patterns, clinicians can narrow differential diagnosis and determine whether further investigation required for malignancy confirmation. As a clinical scientist, we also have to confirm the clinical diagnosis of the patient before releasing the reports. Let's come to the topic, leukemia. What is leukemia? We discussed about leukemia. Leukemias are a group of disorders characterized by the accumulation of malignant white cells in bloodstream and bone marrow. These abnormal cells cause symptoms through bone marrow failure, leading to anemia, neutropenia, and thrombocytopenia, and infiltration of organs including liver, spleen, lymph nodes, meninges, and skin. There are lots of symptoms. Leukemia are a group of disorders characterized by the accumulation of malignant white cells in the bone marrow and blood. Look, you can see here swollen lymph nodes, bleeding easily, nosebleeds, red spot on skin, severe infections, fever, fatigue, weight loss, lots of symptoms. These abnormal cell cause symptoms because of bone marrow failure and infiltration of organs. Bone marrow failure, due to bone marrow failure, anemia, neutropenia and thrombocytopenia will be there for leukemic patients. Organs like liver, spleen, lymph nodes, meninges, brain, skin or testes infecting. What are the functional changes due to leukemia? That is pathophysiology. There is genetic mutations. There are some genes which control cell growth and division in our body. In genetic mutation, it will affect some genes controlling cell growth and division, leading to uncontrolled proliferation of abnormal cells, primarily white blood cells, impaired production of other healthy cells. Then increased proliferation, uncontrolled cell division due to activation of oncogenes and growth pathways creates expanding populations of abnormal cells. Reduced apoptosis. What is apoptosis? Apoptosis is a kind of cell death. Malignant cells avoid programmed cell death, allowing accumulation of abnormal cells that would normally be eliminated. Blocked differentiation. Cells fail to mature properly, resulting in accumulation of immature blasts that cannot function as normal blood cells. Then let us go to leukemia causes. There are lots of reasons. There is genetic factors, environmental factors. There are some pre-existing conditions. Genetic factors, chromosomal abnormalities like Philadelphia chromosome in CML, chronic myeloid leukemia. Then genetic conditions, Down syndrome patients, Fanconi's anemia, Lafroni syndrome, specific gene mutations affecting cell growth and regulation. Environmental factors, now it's widely affecting. Ionizing radiation exposure, chemical exposure, prior chemotherapy, viral infections like HTLV1 associated with adult T-cell leukemia, pre-existing conditions. There are some underlying conditions, that is MDS, myelodysplastic syndromes, aplastic anemia, weakened immune system, advanced age. These causes, we should aware of these causes because in some competitive examinations they are giving the clinical significance or the case history, like the patient has having like of aplastic anemia or weakened immune system, then the patient is affected with this disease situation. What is the kind of disease? So it will be helpful. Now let us go to classification of leukemia. Leukemia is classified into a variety of large groups based on how fast it progresses and the type of cells involved. According to the fastness of its progress, it is divided as acute and chronic leukemias, and the type of cells involved, it is classified as lymphocytic and myelogenic leukemia. Mainly there are 4 types of leukemias. See, acute lymphoblastic leukemia, acute myelogenous leukemia, ALL and AML. Same like chronic lymphoblastic leukemia, chronic myelogenous leukemia, CLL and CML. The classification is depends on WHO and FAB. Regarding this classification according to WHO and FAB, a detailed class we will discuss in later. Now, the diagnostic approach to leukemia, how the leukemia is diagnosing. At first, peripheral blood analysis, FBC, complete blood count with the differential examination of blood smear morphology for abnormal cells and identification of characteristic findings. Blast percentage is critical for classification. Then, bone marrow evaluation. Aspirate and biopsy for morphological assessment, cellularity and percentage of blast. Cytochemical stains like myeloperoxidase and Sudan black B we are using for bone marrow examination. It will help to differentiate myeloid from lymphoid lineage. Next, immunophenotyping. Flow cytometry identifies cell surface markers to determine lineage and specific subtype. Important markers include CD13, CD33 for myeloid, CD19 and CD20 for B cell, and CD3 and CD7 for T cell. Cytogenetic and molecular analysis. It is very important for prognosis assessment and treatment selection. Karyotyping, FISH and molecular techniques identify chromosomal abnormalities and gene mutations that guide classification, prognosis, assessment and treatment of leukemia. Let us go to cytogenetic analysis. Cytogenetic analysis, from the term itself we can understand it is chromosomal studies. Studies the structure and number of chromosomes within the cells. The techniques used are karyotyping and fluorescence in situ hybridization, FISH. In the karyotyping, visual examination of chromosomes under a microscope to identify abnormalities like translocations, deletions, insertions, and aneuploidy. Aneuploidy means abnormal chromosome number. In FISH, we are using fluorescent probes to detect specific DNA sequences on chromosomes, enabling the identification of specific gene rearrangements or deletions. In molecular analysis, studies DNA, RNA, and proteins at the molecular level. Techniques used are PCR, NGS, qPCR, gene expression profiling. PCR amplifies specific DNA sequences for detection and analysis. NGS means next generation sequencing. It allows for the simultaneous sequencing of millions of DNA fragments, enabling the identification of gene mutations, rearrangements, and changes in gene expression. Quantitative PCR, that is qPCR. It measures the amount of specific DNA or RNA sequences. Gene expression profiling analyzes the expression levels of multiple genes. And we are going to an important topic, acute leukemias. What are the clinical features and diagnosis? Minimum percentage of blasts in bone marrow required for acute leukemia diagnosis is 20%. It is an important question for competitive examination. What is the blast threshold for acute leukemia diagnosis? So, minimum percentage of blasts in bone marrow required for acute leukemia diagnosis is 20%. Percentage of childhood leukemias that are acute lymphoblastic leukemia, ALL, 75% ALL in children. AML or acute myeloid leukemia predominantly affecting adults, middle-aged adults, almost 65 years. Acute leukemias present with symptoms of bone marrow failure, fatigue and pallor due to anemia, infections from neutropenia and bleeding from thrombocytopenia. Tissue infiltration causes specific findings include lymphadenopathy, hepatosplenomegaly, gum hypertrophy in monocytic AML, skin infiltration and CNS involvements. Rapid diagnosis is essential as these are medical emergencies requiring prompt intervention. This distinction between AML and ALL is critical as treatment approaches differ substantially. So once if we differentiate AML and ALL, it will be easy for a clinician to plan their diagnosis. So always keep in our mind that according to our diagnosis, a clinician is planning their treatment. Now I'll go to chronic leukemias. Leukemia types are CML, CLL, hairy cell leukemia, T cell leukemias. CML, the key molecular features are Philadelphia chromosome, BCR AB L1 fusion. Philadelphia chromosome 9:22. The clinical presentations are often CML is asymptomatic. Splenomegaly will be there, hypermetabolism is there. The age distribution is in between 30 to 60 years. CLL or chronic lymphoid leukemia. Impaired B cell apoptosis and weak surface antigen. The clinical presentations are lymphadenopathy and immunosuppression, also cytopenia. In CLL, cytopenia will be there. The age group is in between 60 to 80 years. Hairy cell leukemia, BRAF V600E mutation. The clinical presentation is pancytopenia, splenomegaly and monocytopenia. It's affecting middle-aged adults. T cell leukemias varies by subtype HTLV1 in ATLL. The clinical presentations are lymphocytosis, variable organ involvement, varies by subtype. Chronic leukemias are characterized by slower progression and accumulation of more mature but functionally impaired cells. Just remember, in chronic leukemias, there are more mature cells, but these cells are functionally impaired. Diagnosis often occurs incidentally during routine blood tests. When we are doing routinely on blood tests, the diagnosis is happening randomly. Treatment approaches have evolved dramatically with targeted therapies like tyrosine kinase inhibitors transforming prognosis in CML. Molecular diagnostic techniques are essential for accurate classification and therapeutic decision making in these disorders, as we discussed earlier. And that wraps up part 1 of our leukemia tutorial. I hope that we covered the basics. What leukemia is, its main types, and how it affects the body. If any doubts, please give a message in the comment box. In part 2, we will dive deeper into different kinds of leukemias and its diagnosis. Don't forget to like, share, and submit. See you in next video.